There you go. And today is March 24th, and we're good now because Dr. Langston Maiden is here with us. Now everything seems to be working well. If something is not, please let me know in the chat box. As you already know, I'm Sandra Arevalo. I'm the Director of Community Health and Wellness at Montefiore Nyack Hospital. And with us today, the Director of the Multiple Sclerosis Center, Marin Borelli, right? It's the name.
Adeline Borelli, yeah.
Adeline Borelli, Multiple Sclerosis Center, Dr. Christopher Langston. So first of all, I'm going to ask you, Dr. Langston, if you can talk a little bit about the MS Center before we start talking about what MS is and all of that.
Sure. So my name is Christopher Langston. I'm the director of the Madeline Borelli Center at Montefiore Nyack Hospital. I'm also an assistant professor at Albert Einstein College of Medicine, which is why I'm zooming to you from my car after teaching class this morning. So our center has been open now for, this is our 11th year in Rockland County, providing multiple sclerosis care for patients with multiple sclerosis and related disorders. I've been at the center now for about a year and a half. And before this, I was a fellow in neuroimmunology at Mount Sinai Hospital in Manhattan. And before that, I was the chief resident at Mount Sinai and a resident there. So I'm glad to be able to talk to you today about our center and about multiple sclerosis so that everybody can, advance their understanding of the kind of care we provide.
Mm-hmm. Now, multiple sclerosis is not a very common disease. How many people do actually suffer from multiple sclerosis?
There are different estimates. The most recent estimates, which are based on insurance claims, suggest that there are about 1 million people in the United States, maybe as many as 1 out of 300 or 1 out of 400 people have MS. A lot of the people that do have MS, we don't even know that they have MS because they're not walking around saying it to us, but chances are most of us know at least one person with MS.
Now, they're not walking around saying it to us because they don't want to say it to us or because they can't be walking around.
Both. Well, maybe both. A lot of times they look like you wouldn't know that they had the disease. A lot of the times the analogy that I use for multiple sclerosis is it's similar to having high blood pressure. It's a silent disease for a lot of the course of the disease. People don't know that they have it, or when they do have it and it's under control, you wouldn't know that they have it until something bad happens. Like with high blood pressure, you could have a heart attack or a stroke. With multiple sclerosis, you can have multiple sclerosis relapses, which can cause symptoms, and eventually that becomes apparent to other people, but causing disability. But a lot of people, if their disease is under control, you would never know that they had any symptoms at all.
So, Dr. Langston, that sounds very interesting, and maybe that's a good approach to understanding what multiple sclerosis is. So can you put it in terms of a patient? Let's say, I'm living a normal life, and how do I find out that I have multiple sclerosis?
So there's 2 different pathways that people ultimately find out that they have multiple sclerosis. One is they have a symptom, they go to the doctor, and it gets investigated, and eventually it's determined that the cause of that symptom is multiple sclerosis. And the other pattern is people go to get an MRI of their brain or spinal cord for a completely different reason. They have headaches, they hit their head in a car accident, or when they're playing sports, and they get an MRI, and it's discovered incidentally as a part of the workup that, oh, there's some things on your MRI that look like multiple sclerosis. And those are basically the 2 pathways that people come to attention.
Mm-hmm. So I guess headache is one of those common symptoms of MS?
Headache itself is an uncommon symptom of MS, but headache is so common in the general population that a lot of people will get an MRI to try to figure out why they're having headaches, and it'll be incidentally discovered that, oh, there's signs of multiple sclerosis here.
Mm-hmm. So what is multiple sclerosis?
Well, that is the $64,000 question, because in some sense we don't know. Well, we know a lot about the disease, but we still don't know ultimately what causes multiple sclerosis. Multiple sclerosis is an autoimmune disease where your immune system becomes confused and it thinks that your nerves and your central nervous system, or really the covering of your nerves, is some kind of foreign invader like a bacterium or a virus. And so it tries to destroy them, thinking that there's something foreign, but actually it's you. And so that accumulates damage over time that causes patients with multiple sclerosis symptoms. The way that our immune system gets confused is probably three different things have to happen. First, many people with multiple sclerosis have some genetic susceptibility to autoimmune conditions. It's usually not very strong, but there's some evidence that there's the susceptibility to it. The second thing is it's very likely that they have to have had mononucleosis or Epstein-Barr virus at some point in their lives. And Epstein-Barr virus is a virus that causes mono. It also causes certain other conditions, and it hijacks the immune system and can throw it off a little bit. And then likely there's some third thing that our immune system comes in contact with, which triggers our immune system to think that our nerves are something foreign, and that's when our immune system starts attacking the nerves in the central nervous system.
Now, you also mentioned some attacks. You know, you said some people like get an episode or something, and that's how we find out. So what do those episodes consist of?
That's a great question. So one of the ways that when your immune system is fighting an infection, it ramps up in response to try to overwhelm the infection. So the same thing when because in multiple sclerosis, your immune system is confused and it thinks that it's fighting an infection, it gets fixated on something in your brain and it starts trying to destroy it. And so what happens is there's this spreading wave of inflammation that happens in the brain or in the spinal cord. And depending on where it is in the brain or spinal cord, it will trigger symptoms in the patient. And because it can be anywhere in the entire central nervous system, the number of symptoms are pretty much anything you can imagine. So it's if we sort of move from the front of the brain to the tail of the spinal cord, the first thing that can be affected is the nerve to the eye. And so the way a lot of people, one of the most common ways that people can present with multiple sclerosis is losing vision in one eye. The classical ways they lose vision in half of the visual field, like the upper or lower half. But sometimes people say, oh, I just thought I had a smudge on my contact for a couple of weeks and it didn't go away. Moving backwards, it can be anywhere in the rest of the brain, including it can be sensory symptoms like numbness, tingling, burning. Sometimes people one very common thing is phantom skin wetness. People feel like they feel something wet on their skin and it's completely dry. It can be problems with coordination and balance. Sometimes people think that they're always been clumsy or they keep dropping things, but actually, this is a sign of imbalance and lack of coordination. Sometimes it can be weakness in a particular side of the body, either an arm, a leg. Sometimes it's just, a single a finger or something like that. Commonly is foot drop. They can't get their foot all the way up, so they trip when they try to walk up the stairs. And then there are other things that can happen are it can interrupt the connections in your brain and your bladder. So people can begin to develop urinary problems, urinary frequency, frequent UTIs, things like that. There's so many symptoms. I could talk about all of them, but those are the most common ones that people with MS will present with.
And around what age starts MS presenting?
MS is interestingly enough, autoimmune conditions are present in different ages and in different demographic groups. MS presents mostly in younger women, but not exclusively. It's about 3 to 1 women to men. And they're usually in their 20s or 30s. It can occur in younger age groups, like it does occasionally occur in children, and it sometimes shows up in the elderly out of nowhere. But the most common and prototypical case is younger women in their 20s and 30s.
And what's the life expectancy?
Life expectancy of people with MS is generally very good. It is very similar to that of people without MS. It's about 2 years shorter on average, And that's basically because some patients have very severe disease that can impact their ability to swallow, or gives them frequent infections. And because of those frequent infections, or difficulty controlling their ability to swallow, they can get pneumonias and expire sooner than other people. But that's a very rare thing, and it's not the typical experience. So most people live a completely normal length life.
Mm-hmm. And you were talking about diagnosis. You mentioned MRIs. Are there any other tests that diagnose MS?
Yeah. So there's a couple questions. One issue is, how do we diagnose MS? And another question is, how do we monitor it? And there's some overlap between those. So the way we diagnose it, we can diagnose MS just by the a history and a clinical exam. If you tell me, I lost vision in one half of my vision over 3 to 5 days, and it got better over 2 weeks, and then 3 months later, I woke up one morning and my right foot was dropped, and I had trouble walking up the stairs, and it got better over 3 weeks, and I examine you and find signs of multiple sclerosis, that right there is sufficient to establish the diagnosis. It's not always the case, though, and so we use extra tests to try to give us more information. The next test we use the most often is MRI, and then sometimes we also use additional lab tests, like a lumbar puncture or certain blood tests.
Mm-hmm. Now, it sounds very interesting to me, everything that you're saying, because these symptoms, I wouldn't think about going to a neurologist or an MS center to talk about these symptoms. I will think that you will first go to your PCP, your primary care provider, and, illustrate what's happening. Are primary care providers able the same way as you are to diagnose MS just based on those symptoms that you mentioned?
They can, but
Mm-hmm.
yeah, no, that's a great question. Primary care providers can diagnose it, and sometimes they do. But it is a difficult diagnosis because, as you mentioned, it's unique to each patient, and the symptoms could have so many different explanations, sometimes potential explanations. So oftentimes a frequent pathway is people go to their primary care doctor with a symptom. The primary care doctor does some tests to try to rule out some other common causes, and then refers the patient to a general neurologist who does some additional tests, often an MRI. And then when there are signs of MS, we'll refer to an MS specialist who helps either confirm the diagnosis or even disconfirm the diagnosis and reassure the patient.
And talking about that, we have a question here. It says, to your knowledge, has MS ever been misdiagnosed as carpal tunnel?
That's really interesting. I apologize. I'm sitting outside a hospital, so there's a lot of ambulances coming by. I've never heard of it being misdiagnosed as carpal tunnel, but anything is possible. So carpal tunnel has certain kinds of typical symptoms. It usually presents with pain, which is not very common with a lot of MS presentations. So pain in the hands, especially in these first 3 digits, the thumb, the first and second finger, you can get numbness there. But the pain often awakens people at nighttime. That's typical carpal tunnel. Certain things make it more common, like pregnancy and things like that. But that's typical carpal tunnel. MS can present with numbness in the hand. It can present with weakness, and it's sometimes with certain kinds of pain in the hand. But so there can be some similarities, but the way you would work them up would be different. Carpal tunnel is diagnosed with a nerve conduction study where they basically measure the electrical flow in the hands and in the arm, whereas MS is going to be diagnosed more with an exam and with an MRI.
Okay. And we have another question. Is MS genetic? Is there a history in families?
Yes, it is partially genetic. So MS is MS. I might have to move forward a little bit. MS is it is predominantly found among Caucasians. Okay, And so there seems to be some connection there. The other thing is it does run a little bit in families, but there isn't a strong family connection. So the way we talk about this in terms of genetics is there's a 3% concordance. So that means that, you know, if one twin has MS, the chance that the other twin will have MS is about 3% higher than the rest of the general population. So it's not a huge increase in risk. So a lot of parents come to me and say, what about my children? I have MS. What's going to happen to my kids? And I said, there is some increased risk of MS in your children, but it's not that strong. And there's certain things you can do to offset the general risk going forward. Make sure that autoimmune condition is more common in people who are obese, so try to avoid obesity in your children. Secondly, there seems to be a connection between low vitamin D and MS, and since we shouldn't, you know, try not to have low vitamin D anyway, making sure that, you know, your children have a regular normal vitamin D, and the last thing, excuse me, and the last thing is just make sure that your kids stay active and are in good physical condition anyway, because even if they do get MS, the better physical condition you are, the better you'll do with the disease.
Now let's talk about treatment, Dr. Langston. Once I am diagnosed, what happens?
So there's sort of 3 stages to thinking about MS. The first is diagnose and confirm the disease. Okay. Second is to go on a disease modifying treatment that tries to slow or prevent the disease from progressing. Okay. The analogy here, like I said before, is to high blood pressure. We can't cure the disease, but we can control it. And we try to adopt a medication that's going to give you optimal control with the fewest side effects. There are more than 20 different treatments for MS. So we have lots of options to talk about. Generally, I can't talk about all the options with every single patient. So I'll sort of ask them a couple of general questions, get a feel for what matters to them, and then we'll pursue a limited number of options. And if they don't like those, then we'll go to some others. And once we've kind of got them on a treatment that is either slowing or stopping their disease so that they're in full remission, because that's our goal, there are additional treatments to try to address their symptoms and try to make them, get them, heal them, basically. So things like, if they're having difficulty with urinary problems, there are medications for that. If they're having trouble with stiffness or sometimes with pain, though I said that's, you know, a little rare, there are other treatments we can use for that that are different than, say, just standard pain treatments. And so the idea is we kind of go in this stepped approach from diagnosis to disease modifying therapy to symptomatic treatment, and then with the hope that people will be able to live their best lives.
Are there any side effects, or especially of the medications for MS?
Yeah, the way I usually think about a sort of easy way of conceptualizing the trade-off is that anytime you're trying to modulate the immune system, you're going to throw it off a little bit potentially, and so by changing the immune system, you usually increase slightly the risk of minor infections and with some treatments with cancer. So there's a little bit of a trade-off there between the efficacy and the safety. But the most common things we talk about are infection, cancer. Some of the treatments affect the efficacy of vaccines, which has been very important during the COVID pandemic. And that's because there are 20 different treatments, it's hard to go through all of them, but that's the basic trade-off between efficacy and safety, is keeping the disease in check without running the risk of infection or cancer.
Any lifestyle modifications that are recommended for people with MS?
So lots of things. The first and most important thing is physical activity, staying very active, exercising, keeping yourself in good physical condition. 2, maintaining good sleep patterns. A lot of MS patients have problems with fatigue. It's the #1 thing that MS patients complain about. And I mean, we report as a symptom. And so keeping your sleep and exercise in good check is really important. a lot of patients with MS also say, but I've slept poorly my whole life. And I say, well, that's so important why you fix that problem now, because now you have MS and you really have to be sleeping well and getting restorative sleep. And then one thing that, you know, Sandra, you and I have talked about before is nutrition. There's increasing evidence that certain kinds of dietary changes can be really beneficial for MS in terms of reducing brain shrinkage over time and of helping to combat fatigue. So in terms of lifestyle modifications, those are the main things: sleep, diet, and exercise.
Is it okay or even more recommended to do exercise when you have MS, and then what types of exercise?
So the first rule of exercise is safety. You want to do things safely. So especially if you have something like a foot drop, you don't, you know, where you can't get your foot all the way up, you don't want to, the first thing you don't want to do is get on a treadmill where you might trip, fall, and then hurt yourself, because that will only set you back. So safety is number one. You have to find exercise that it's safe for you to do. But there's some additional rules of thumb that you should keep in mind. And the way I talk about it with patients is it's important to do sit-ups and push-ups. The reason being that people with MS have a very specific pattern of weakness when they get weak. They are strong with arm pulling and weak with arm pushing. So you need to work on extension exercises, shoulder presses, push-ups, things like that, to keep yourself strong in the arms. And in the legs, it's the reverse. People usually are very strong with pushing and weak with pulling. Leg pulling, though, is mostly the abs, which is sit-ups. Now, you don't actually have to do sit-ups. Sometimes that's too difficult for people with MS to do, or just people are out of shape and haven't done them for a while. But you can start with simpler ab exercises like leg lifts or the iron bridge, where you sort of just stand with your, you know, sit either on your knees or with your legs on your elbows, things like that. But I think the general recommendation for exercise is push-ups and sit-ups.
That's very interesting. And we have more questions. Does it require a special diet aside of pharmacological treatment? So I guess we answered that one. And is it okay for a woman with MS to get pregnant?
Those are great questions. Let's do the pregnancy issue is always a vexed one, because many years ago, when there were no treatments for MS, doctors would tell women with MS not to get pregnant, thinking that the disease was going to make it hard for them to give birth. We've studied this topic a lot as a medical community, and there seems to be very little increased risk of bad pregnancy outcomes in people with MS. So in general, MS should not affect your ability to have children. The one issue around pregnancy that it presents some challenges is how to take medication while pregnant. And so, you know, that because there's 20 different medicines, it's more complicated. Some MS medicines can cause birth defects. So I generally avoid those in women of childbearing, you know, age. And others are great for pregnancy because they're out of the system, but they keep you protected through all of pregnancy. And there's some medications like one of the best known one is called glatiramer acetate or Copaxone, which when the FDA was using pregnancy guidelines, they ranked as category B, which is as safe as Tylenol. So there are some treatments that you can use during pregnancy and MS.
Now, Dr. Langston, how is the pain of MS? Is it intense pain? Is it permanent? Or is there no pain at all?
There's one kind of pain in MS which is directly from the MS, and that kind of pain is called trigeminal neuralgia. It's when the nerve to the face is affected by an MS lesion, sometimes too small to see on an MRI, but it basically creates these electric shocks that spread through the face that are very debilitating. People can't eat, they can't brush their teeth. It's very hard to just do basic tasks. Sometimes people have to be admitted to the hospital for IV fluids. We have some good treatments for this, though, that kind of quiet the nerves down. The easiest thing to do if this happens to you in the acute moment is put a warm compress on your face. And then you can even get some lidocaine cream or something just to make your face in general less sensitive so that it's not irritating the face and that nerve. Most of the rest of the pain in MS is secondary pain from other problems with MS. So a lot of pain in MS comes from nerve pain from things in the spinal cord, or more likely from stiffness. So a lot of people with MS say, my legs hurt, they cramp, they spasm. That's really more from stiffness. And then we have a bunch of treatments for that. Muscle relaxants, even just some kinds of minerals can be very helpful, like magnesium for muscle cramps, things like that. So those kinds of pain are really consequences of other MS problems, but we have lots of treatments for those as well.
Mm-hmm. Now, I feel that when you have a chronic disease, you definitely need like a support group, or like your family, you need some kind of support to live with the disease. So what kind of support is needed in MS? And for example, when you talk to family members of patients with MS, what recommendations do you make? I'm thinking maybe somebody here is listening who has a loved one who has MS, and obviously we always want to help them so much, but we don't know how. That's kind of what I'm getting to.
That's a great question. I myself struggle with this with patients too, because I think some patients want to feel very resilient, and the other patients want to reach out and talk to somebody who, is going through what they're going through. So every patient is a little different. I think the best place to go for this is to go to the National MS Society website. The National MS Society has a MS Navigator program that helps direct patients to support groups that are right for them. So some patients like to go in person or a Zoom call and meet with lots of other people. For some patients, that's not really their thing. They're maybe a little shy, or they don't like sharing a lot of things in front of people. So they have a pen pal program, or they have one-on-one support where they can connect you with one other patient with MS from across the country who you can talk to about your problems, who's maybe either the same age group or different age group, or whatever it might work for you. So the nice thing about the MS Navigator program is it's able to direct you to the resources that might be right for your loved one or for yourself. That may not be right for everybody.
Mm-hmm. And we got another question. Jill is saying, I am hearing more people are getting diagnosed with MS. Do you think it has anything to do with our environment and lifestyles?
That's a great question. I don't want to speculate because there's so many options. There's a couple of things going on there. One is that we are seeing increasing levels of MS, but part of that is that we're just getting better at detecting it. So it used to be that, we knew when people had MS because they were severely affected, because we didn't have MRIs, we didn't have, blood tests and things like that to try to diagnose the disease. We're finding a lot of people who have MS, which is much milder now. Another part of it is there's probably some environmental factors that are figuring in this that we haven't quite figured out. So for example, one hypothesis that could be part of this is that there was a thought that one virus that might be partially responsible for MS is canine distemper virus, obviously, which is spread by dogs. So it's possible that there might be certain environmental influences like that. Unfortunately, as of yet, since we haven't identified what those environmental influences are, it's hard for us to make any recommendations about how to live your life differently to avoid MS. I mean, I would, nobody should get rid of their dog just because of what I said, but we don't know yet what connections there could be in the environment.
Mm-hmm. And we just got another question. Is a cold or hot weather an aggravating factor?
Yes. So, and what does it mean to be an aggravating factor? Generally what happens in MS is, actually it happens with all human beings. Whenever we get our central core body temperature goes up, our nerves slow down. Okay, so any of us, when we get into a hot tub or take a warm shower, our nerves will all slow down their conduction a little bit, and we're just not aware of it. When our nerves get too cold, the same thing can happen, but also our muscles will start to stiffen because of decreased electrical conductance in the muscles as well. So at the extremes of hot or cold, we start, every human being, we have differences in how our central nervous system responds. People with MS are a little bit more prone to this because of the damage caused by the disease. So they will feel things in hot weather a lot more than the average person. And with cold weather, they'll often get a lot more stiff and have problems. It's interesting, there's kinds of two patterns. There's certain patients who the worst times of year for them are the deep winter and the deep summer, and like spring and fall are perfect for them. Where I have other patients who it's really the transition as we move from winter to into summer, and from summer into winter, that it really represent the worst challenges for them. So it's hard to predict, but those are the general principles that are applying.
And the questions keep coming. Is frequent cramping of leg and other muscles a possible sign of MS?
Yes, it could be. It could be a lot of things. So you should talk to your doctor about
it. Now, what about the question is about cramping, but also what about, like if your legs get numb too much, or your feet, your hands, numbness?
Numbness can also be a sign of MS, because if you get especially MS lesions and little focal parts of inflammation in the spinal cord, that in the tracts that carry sensory information from your feet or your hands to your brain, you can get some numbness in the feet or hands. Part of the thing that can help distinguish the numbness in MS from other causes of numbness is the pattern of the numbness, and also extra testing the nerves in the arms or legs, and testing, looking in the spinal cord with MRI to see if there are any lesions there that we can visualize.
And what's the pattern?
Well, for example, like here's another super common cause of numbness: diabetes. Diabetes, though, it's a different thing. The peripheral nerves in our legs, because they're so long, are more prone to damage from high amounts of sugar. And so, because nerves are not very good at handling high quantities of sugar, and so as they get damaged, you get this ascending pattern of numbness in diabetes. Similarly, there's a certain pattern of numbness that can happen with like alcohol abuse. People drink too much alcohol, they can get numbness and tingling starting in the feet. It's often painful in the bottoms of the soles. And so that's sort of similar, but has a different pattern than typical MS numbness.
That's very interesting. Well, we are towards the end. Thank you so much for being here. And I know that you kind of put your whole day in pause just to join us. So thank you for that. So last question. It's 17 of us listening to you right now thinking, oh my God. So what's the protocol that we need to follow if we think we might have MS? We go first to the primary care provider, we come straight to you?
The best way to do it is first talk to your primary care provider, or if you're already seeing a neurologist for headaches or something like that, you can talk to your neurologist about it. And get some preliminary testing done, because oftentimes it takes a little while for MS patients to get diagnosed, because their symptoms are very nonspecific and could have so many potential causes. So working through some of the most common causes with your either primary care doctor or general neurologist can really help you identify maybe more common causes before you start looking into MS.
Okay, and my very last question, Dr. Langston, what sparked the interest in you to be a specialist in MS?
That's really interesting. I had thought about it because I had a cousin who had MS, and so I was always interested in the subject, but it was a subject she didn't like talking about, so I never knew. As I was going into medicine, I kind of knew I wanted to do neurology, but I didn't really know what part. And I was always interested, thinking in the back of my head about multiple sclerosis. And then kind of by chance, when I was in medical school, they started rearranging the curriculum. And so I ended up being put in a sort of strange clinic that most of the time patients don't get, students don't get sent to, which is the multiple sclerosis clinic. And they ended up having this great teacher, Dr. Peter Riskin, who had been, I found out later, has been an inspiration for a lot of other multiple sclerosis doctors. And he got me super interested in it. He was a great teacher. He was great examining patients. He was extremely caring and thorough. And I just think that spending time with him made me really want to do MS after that, because I like the patients and the kind of clinical care you can provide. So it was just a great experience.
And that sounds exactly like you're very caring and you're very patient and you're very personable. And I have to say, not just because he's looking at me, but we do a lot of work together and it's great working with Dr. Langston. It's really amazing. So people are already saying thank you in the chat. Thank you so much for this valuable information. Thank you for, again, making time for us. And I'm gonna share, when I send the recording, I'm gonna share the information to the MS Center so that if people have any more questions or they have any people that they know with MS, you can always refer to the MS Center. And, March is MS month, actually. So we've been doing a little bit of education about MS. Dr. Langston, thank you so much. And I will see you around here in the clinic.
Thank you again. I really appreciate it. Thank you.
And thank you to all of our attendees. I will see you next week. I don't remember what the topic is next week. Is actually falls prevention. We're going to be talking about the spring back from falls. So how to prevent falls, and then in the event that you fall, what do we do as well? So I'll see you next week. Thank you all.